Reamberin has an antihypoxic and antioxidant effect, having a positive effect on aerobic processes in the cell, reducing the production of free radicals and restoring the energy potential of cells. The drug activates the enzymatic processes of the Krebs cycle and promotes the utilization of fatty acids and glucose by cells, normalizes the acid-base balance and blood gas composition. It has a moderate diuretic effect. Indications: Reamberin is used in adults and children from 1 year old as an antihypoxic and detoxifying agent for acute endogenous and exogenous intoxications of various etiologies. How to use: adults administered intravenously by drip at a rate of 1 to 4.5 ml per minute, up to 90 drops per minute. The average daily dose is 10 ml per kilogram. The course of therapy is up to 11 days. Children injected intravenously at a rate of 6 to 10 ml per kilogram per day at a rate of 3 to 4 ml per minute. The course of therapy is up to 11 days. Use in elderly patients. Studies in elderly patients have not been conducted. In this regard, the use of the drug should begin with a slow rate of administration, 20 to 40 drops, 1 to 2 ml per minute. Use in patients with renal insufficiency. Studies in patients with renal insufficiency have not been conducted. In this regard, it is recommended to exercise caution when using the drug in such patients. Use in alkalosis. If decompensated alkalosis is detected, the use of the drug should be discontinued until the acid-base state of the blood is normalized. Contraindications: individual intolerance, a condition after a traumatic brain injury accompanied by cerebral edema, acute renal failure, chronic kidney disease stage 5, pregnancy, breastfeeding. Precautions: due to the activation of aerobic processes in the body by the drug, a decrease in the concentration of glucose in the blood, the appearance of an alkaline urine reaction are possible. In patients with diabetes mellitus and patients with reduced glucose tolerance, periodic monitoring of blood glucose concentration is required. If the color of the solution changes or a presence of a precipitate, the use of the drug is unacceptable. Side effects: with a rapid introduction of the drug, undesirable effects are possible. General disorders and disorders at the injection site, very rarely. Hypothermia, chills, sweating, weakness, pain at the injection site. Edema, hyperemia, phlebitis, immune system disorders, very rarely. Allergic reactions, angioedema, anaphylactic shock. Skin and subcutaneous tissue disorders, very rarely. Allergic rash, urticaria, itching. Respiratory, thoracic and mediastinal disorders, very rarely. Shortness of breath, dry cough. Cardiac disorders, very rarely. Tachycardia, palpitations, shortness of breath, pain in the heart, chest pain. Vascular disorders, very rarely. Arterial hypertension, hypertension. Short-term reactions in the form of burning sensation and redness of the upper body. From the gastrointestinal tract, very rarely. Nausea, vomiting, metallic taste in the mouth, abdominal pain, diarrhea. Nervous system disorders, very rarely. Dizziness, headache, convulsions, tremor, paresthesia, agitation, anxiety. In order to avoid the occurrence of undesirable effect, it is recommended to observe the dosing regimen and the rate of administration of the drug. If adverse reactions occur, it is recommended to reduce the rate of administration of the drug. If any of the undesirable effects indicated in the instructions are aggravated, or you notice any other undesirable effects that are not listed in the instructions, tell doctor about it.